We've seen a decent amount of data about how these abortion bans are affecting general reproductive health access, maternal care, maternal mortality rates. And
Mhm.
on the general subject of maternal mortality, I've talked to founders who say that telehealth can be a real solution in terms of giving access to doula care. So on the telehealth note, I do want to ask a little bit about Charley, the chatbot. You are an advisor to the company. And we've spoken to other entrepreneurial endeavors that give people access to contraceptive care who've seen, let's just say, an increase in interest and inquiry in the weeks after the election. What have you been seeing at Charley? Has there been increased activity since November 5th?
Absolutely. I think at Charlie, folks are seeing the same thing that healthcare providers working in reproductive health across the country are seeing, which is that access to reproductive health care, contraception, abortion is front of mind for people since the election. Because really, one of the big changes we've seen, and I've been working in communications on reproductive health for a while now, one of the big changes is that Americans are increasingly not seeing access to abortion and contraception as a political issue, but as an important matter of health and safety that affects their access to healthcare, their family members' access to healthcare. This has really jumped from the political realm to the personal realm in a very real way. And that's in large part because of personal stories around the impact of abortion bans. So, one of the important things that we're seeing beyond the fact that there is an enormous appetite for information and stories about access to reproductive health care is that there is very little awareness of what care is actually accessible where folks live, which is not surprising because, in many ways, it's deliberately difficult, thanks to abortion bans and restrictions from even before Roe was overturned. It's very difficult to know what is legal where you live, how much will it cost to get an abortion, if I have to travel out of state, what are my options? And one of the most important resources, especially since Roe was overturned, is access to abortion pills via telemedicine, which means you can have an appointment with the doctor remotely. They can prescribe you, or a clinician remotely. They can prescribe you abortion pills. You can receive those pills in the mail. You can take them at home. And importantly, as you're going through your abortion at home, your medication abortion, there are also a number of resources available. The M&A hotline is a great one where medical experts can talk you through what you're experiencing anonymously or answer any questions you might have, address any concerns. This is a really essential resource, especially in states with abortion bans and really harsh restrictions. And such a tiny population, such a tiny percentage of the population knows about this. So, one of the things Charlie is really focused on, the main goal of Charlie, is helping people understand what their options are in a conversational, secure, confidential, and personalized way. Because even for people like me who have been paying very close attention to these issues for quite some time, it's tough to know what website should you go to? Where should you start the process of figuring out how to get the care you need? Charlie really exists to streamline all of the options that are out there and help people parse this really difficult to navigate landscape of options and access to care. The tagline that we like to use is Charlie chats like a friend and answers like an expert.